Today on Aging Untold, virtual healthcare is a growing field, but is it the best care for you?
Telemedicine's amazing until it becomes the substitute for what requires your hands, your eyes, and your ears.
We weigh the pros and cons of telemedicine and discuss its potential impact on your health. Then, do you know what your heart calcium score is?
I had 99% blockage in my main, what they call the widowmaker artery, and I had 85% blockage in the other artery.
We'll tell you how knowing your number could add up to a longer, healthier life. And later, safety with a smile.
They're not allowed to cross unless they smile.
How one school's crossing guard smile is making everyone's day. Experts with advice and solutions. You're watching Aging Untold with Aging Well Coach Catherine Ambrose, gerontologist Sam Craddock, aging expert Amy O'Rourke, and board-certified physician Dr. Ray Rogers. We're all getting older. It's about time we talked about it.
Welcome to Aging Untold. You've probably noticed telemedicine has become more widely used since the COVID-19 pandemic. Now more than 75% of U.S. hospitals offer remote care, up from 35% a decade ago. While it promises greater access to care and convenience, concerns around data security and insurance coverage remain. Amy, telemedicine is now part of the norm in healthcare. Is that a good thing?
Well, I don't think in terms of good and bad, so I'll give you the pros. And it solves a lot of problems. It solves problems for behaviorally challenged people that you can't get to the doctor. It solves the problem of someone needing to take time off work to get the person to the doctor. It solves the older person maybe in inclement weather, can't get to the physician. So I think in terms of where it can benefit, and I know my colleagues have other thoughts about it, but I would kind of filter who you're taking care of and when you can fit it in to make it easier for both the caregiver and the person.
I think it comes down to, again, the circumstance. So you're going to have the pros and the cons, and there's going to be a role for telemedicine. So if you're doing medical management or you're just trying to monitor the response to something that you did recently, you want just a follow-up, I think that is great. It's not going to be a replacement or solution in terms of for a physical exam, because you get so much more of the complete picture with the patient when you have your hands on.
Oh, absolutely. Telemedicine's amazing until it becomes the substitute for what requires your hands, your eyes, and your ears. And so you've got to do real exams, and especially with our older people, you're going to miss so much more. It's so much easier for me to lie to you over a phone or over a screen than it is if you're looking at me and you can see physical changes and you can see that body change or whatever's going on. I tell all of our older people, get your feet looked at your doctor's visits, because that's your foundation. Are the telemedicine doctors doing that? I think it's great for med refills, lab results, things like that. But shortness of breath, how are you going to examine somebody that's saying, I'm having a little shortness of breath? Okay, well, here, we'll send you an inhaler. Yeah. What about a lump? Are you going to find a lump on somebody? Your doctors need to touch.
Yeah, I wouldn't use it as my annual follow-up.
Right.
The annual follow-up, but if you already are monitoring something very short-term or lab results, that's excellent to go over lab results. Or I just started you on a blood pressure medication. If they're having home blood pressures, okay, or any kind of other medication, something I'm monitoring, very short-term.
But even at home blood pressures, are they taking them?
It depends on who's taking it.
Yeah.
And sometimes the
and what
auto
machine
machines are not as accurate as
and
the
what
manual
machine
ones.
they're using.
So it really depends on really what you're managing.
Yeah.
I think mental health is really good for mental health follow-up.
I completely agree with mental health.
And have that, belly-to-belly conversation, being seen eye to eye, and physical touch, just feeling like a little more cared for. But sometimes there is a professional caregiver in the home helping manage that telemedicine visit. So it can be very convenient for people, and their whole day isn't disrupted for something that's routine. But you do have to supervise your loved ones and make sure that they're getting face-to-face with the doctor when it's really important to do so.
And they're actually expressing those concerns. They're actually talking about what's real instead of, oh, no, I feel fine.
Well, that's why it's important to have again, someone else there. I think the other ears and eyes
Right.
to say, no, that's not what's,
Right.
you're able to fill in the gaps.
I agree. I think the hybrid approach is what we're all kind of recommending, that you have both. I was also thinking about people that want to go on vacation and bring their parent with them. And if they had a follow-up,
Yeah,
they could just
sure.
call and check in and not have to not go to a nephew's house or a grandchild's house because of a check-in with a doctor.
Right. I was really surprised. I didn't realize that the VA actually uses Zoom and telehealth. I was like, wow.
Great piece of
it
information.
became a huge thing during COVID, and because we couldn't go out, we couldn't be seen, and then you didn't want to take your aged loved ones, especially into any doctor's office and
Right.
expose them. So it became a huge thing then, and I think, unfortunately, the convenience, it's no different than everything else that becomes convenient. It takes over. And I still think that the human touch and going to the doctor and having them physically touch and put their hands on and feel your lymph nodes and feel those things is real important.
Yeah,
And the
when-
reimbursement actually may be lower too for some.
Oh, yeah, from a
interesting.
physician side.
Interesting.
Yeah, I hadn't thought about that part.
Well, I think it's really interesting that older adults are the biggest users in telemedicine. And it does make it easier on the caregiver and just, can take some pressure off, but you really don't want to defer those physical face-to-face appointments.
Still ahead?
He knew how busy I was, that I wasn't going to take a half a day and do a stress test. So he said, how about a coronary calcium score?
We'll show you how one simple scan can help predict heart attack risks and guide life-saving prevention. But first, how Senior Day Service Centers help seniors stay active,
They get routine, they get activities.
and what you should look for when choosing a program for your loved one. Find more Aging Untold content on your favorite social platform. You can follow Aging Untold on Facebook, Instagram, and TikTok now.
More and more older Americans are aging in place, but many will look for ways to stay social and active. One option that could help: Senior Day Service Centers. According to the National Center for Health Statistics 2022 data, there are more than 3,000 Senior Day Service Centers in the U.S., serving roughly 200,000 participants. Ray, what services do these centers provide, and when should families consider a day service center for a loved one?
I think it's a great concept. This concept of adults being able to go somewhere that's actually supervised, staffed, and it allows the caregiver to get some rest. And a lot of the actual seniors, I know some, they look so forward to it. Like when the buses can't run because there's snow or the rain, they're really upset. I think that's their excitement. They get out, caregiver gets rest, they get excitement, they're getting away also. They get routine, they get activities. It depends on what kind of facility you're going to, but I think people can look and see if it's something that they need for their patient or their loved one.
And I think, yes, you keep saying the caregiver gets to get rest, and that would be great, but sometimes they just get to go to work. If you're caring for an aging loved one and the question of safety comes into play, or just socialization even, and you're still having to work, home care is expensive. And this is the alternative to bringing in caregivers into the home is, can we take mom or dad or grandma or grandpa, whoever's in need, can we take them to this place where they get socialization, they get good food, they have monitoring. Some of them are, heavy on the social activities, and then some are actually more heavy on the care, depending on the organization. And then you can go to work with the peace of mind of, I'm not going to get 20 phone calls. I'm not worried about whether the house is burning down. I'm not worried about whether or not maybe you walked out, if there's a little bit of memory stuff going on. So there's some really good aspects for the caregiver. And that, even if you're at work, that peace of mind is a respite.
Kind of like the same concept of your children going to school.
Yeah.
They go to school, you go to work.
Yeah, and the peace of mind that you get knowing that they're taken care of.
I think too, you can do a 4-hour shift, you can do an 8-hour shift. Some of them provide transportation, they'll pick them up, bring them home. And then, like you said, the cost of home care, kind of blending this concept with home care can extend the amount of time that you can stay at home. And it's interesting to me how different organizations do the day center concept. religious organizations, churches sponsor daycare programs. Assisted living communities, they will oftentimes have a daycare program. I remember years ago, I worked in a nursing home, and the administrator established a daycare within the nursing home. So I think it would be important to look at your local area and see who's doing these day center programs.
And some of them are covered under your Medicare Advantage plan. So check with that and see. A lot of the Medicare Advantage, they offer these programs, and they're incredibly well run.
They're really quite something to go visit. So it allows you to earn, run your household, maybe do your workouts, do the things that you need to do while your loved one is having hopefully a good day.
Any suggestions on how to choose?
Looking at who you're needing the care for, like Sam said earlier, if it's a heavy medical need, look for a day program that has heavy medical. And then in terms of the cost, some programs offer sliding scales where they'll bring the cost of the day program down, and some states offer Medicaid waiver programs that will help pay for that care. So look at the need, and then look at what your budget is, and look at what's more affordable for you.
And you can save some of those pennies for the bank for later when the care needs are more.
Absolutely. So really great option. And we're all about solutions here on Aging Untold, and we've got more coming. Stay with us.
Coming up,
It's just a natural thing to do. There's no other reason to do it other than we're all happy. Makes us all happy.
a crossing guard who brings joy to her corner of the world. Next,
The heart disease truly is, now I know, a silent killer in women.
we explain how a 10-minute test and knowing your number could add up to a longer, healthier life.
When it comes to heart disease, early detection can be life-saving. One of those tools is the coronary scan. It uses X-rays to identify and measure calcium buildup in the coronary arteries, the vessels that supply blood to the heart. The scan can flag problems often before symptoms appear. Kim Clark shows what happened after one woman took the time to check her score.
St. Francis Hospital Bartlett Administrative Offices.
Carol Harris, executive assistant to the CEO of St. Francis Hospital Bartlett, is usually on the go.
It's very, very busy, you know.
While on one of her jaunts through the hospital, she ran into the chairman of cardiology, Dr. Muhammad Janjua. Pretty common since they've worked together for the last 10 years, but this time the doctor noticed something off.
She told me that when she walked from her office to the cafeteria, by the time she reached there, she noticed that she's short of breath, her heart is racing, and some chest discomfort which she was not able to describe much, and wheezing at the same time.
Carol, a relatively fit woman in her early 60s, blamed her symptoms on an earlier bout of bronchitis and put off Dr. Janjua's suggestion that she take a stress test.
So he knew how busy I was, that I wasn't going to take a half a day and do a stress test. So he said, how about a coronary calcium score?
After about a month of cajoling by Dr. Janjua, Carol finally agreed to take a 10-minute non-invasive coronary calcium scan, which measures the calcium buildup in her coronary arteries. Well, Carol's score in that scan was 676. Normal is 0. Well, that convinced Carol it was time to finally take that stress test, which she took and failed. The following day, Dr. Janjua placed 2 stents in her arteries.
And he was looking at the blockage, and I had 99% blockage in my main, what they call the widowmaker artery, and I had 85% blockage in the other artery.
The stents worked in the short term, but within 2 months, Carol needed double bypass surgery. Carol says she was in the right place at the right time, blessed to work at a hospital where a doctor spotted her symptoms on site, because many women have no idea they too could be on the precipice of heart attack or failure.
Their symptoms are majority of the time shortness of breath, extreme fatigue, tiredness, racing heart rate, mild chest discomfort or jaw pain. So if somebody is above age 45 or above or having any risk factors, including like family history, they diabetic, smoking history, high blood pressure, they should do a screening test.
Dr. Janjua says the majority of hospitals have coronary calcium scoring available. Any score higher than 400 is abnormal, and you should see a doctor immediately.
So it's a wake-up call, you know, to not have any symptoms except for a little shortness of breath that I associated with just running around, that the heart disease truly is, now I know, a silent killer in women.
I think it's really pretty common. A lot of women, a lot of times, will think we're really anxious and all that, and they kind of discard the shortness of breath, like I'm kind of rushing, she's very busy. But when you're fatigued, shortness of breath, high blood pressure is another one that will present with a lot of fatigue that people will miss as well. So that coronary artery calcium score test is a really good test because it's very short. I think one pitfall, I don't know where you guys live, is that insurances don't cover it. In my city, insurances, they don't cover it. It's not really expensive, it's about $75, but if you're on a fixed income, that can be
$75 is $75.
I thought it was terrifying. When I was quite a bit heavier than I am now, it would be normal to be out of breath. I'm like, oh my gosh, that just really scared me. And so if I experience symptoms like that again, I know to go get that checked out. Thank goodness she lived in a hospital, or lived in, probably felt like she lived there, but worked in a hospital, and that doctor took the time to really get after her to go get tested.
I think we all discount shortness of breath. I don't think we understand how much that is related to our cardiovascular system, and that the blood is what carries the oxygen. And if it's not pumping well, if we're not hydrated, you know, all those things add up.
I think the key is it doesn't improve over time.
Right.
That's the key.
Right, because I was watching that and I was thinking, I could discount all those symptoms. I've worked hard, been under stress, didn't get enough sleep, and written off all of it. But if it doesn't change over time, that is a wonderful tip, Dr. Ray.
Right. Believe it or not, that plaque buildup is what it's showing, but there actually is another test that has come out that has a software that picks up the non-calcified plaque, which is even more dangerous. And they try to convert that into plaque.
Wow.
Interesting.
Okay.
Not covered by insurance and very expensive.
There's,
Of course.
there's so much to know,
There is so much
really
to know.
and that's why we're talking about it.
Up next, we'll show you how one woman is teaching the golden rule, guiding kids in more ways than one. You can watch Aging Untold anytime online. Go to aginguntold.com or subscribe to the Aging Untold YouTube channel for more.
Teachers often get credit for shaping our kids, but you may want to give a shout out to the person who stops traffic every day to make sure kids get to school safely. Ashley Hendricks shows us how one school crossing guard outside Richmond, Virginia, inspires acts of kindness from her students and their parents.
Whether dropping off
Hi, sweetheart.
or picking up,
Oh, so keep going.
Ms. Pinkham will always be there.
Higher up? Oh, goodness. Yeah.
Standing at the corner of Alicia and Galaxy with a wave and a warm smile.
We get high fives in the mornings and high fives in the afternoons, and a great smile, because they're not allowed to cross unless they smile.
The moment just outside of Henrico's Elizabeth Holiday Elementary is short but sweet.
And I don't think she realizes how important she is to these children. Like the smiles that she puts out, you know, it makes everybody's day.
It's the best part of the day for Allison Moorfield and her son Briggs.
Sometimes I'll come this way when I'm not dropping my son off just to see her, just to wave, just to get the wave and the friendly smile.
And on any given day, students will shower her with gifts of appreciation.
This here is a bracelet one of the gals gave me yesterday. On my keychain for Christmas, someone made a tag, I guess, for my keys.
She's collected many handmade trinkets since starting here 4 years ago.
I'm gonna let this one out.
It's no accident that her style of directing traffic would lead straight to the hearts of so many.
It's just a natural thing to do. There's no other reason to do it other than we're all happy. Makes us all happy. Good afternoon. Have a great afternoon.
The joy that gleams from the young faces here, Allison says, is just as important as keeping them safe. No matter if it's in the morning or in the afternoon.
This way.
Ms. Pinkham's motto will remain the same.
Smile a day is priceless.
Those children and families will remember her for the rest of their lives.
Right.
What an impact. And teaching people to smile, I just love it.
I know. I ride my bike about 10 miles when I go. And when school lets out, there's a crossing guard, and I do the same thing. I go by because he's so sweet and he's so friendly. So I was like, oh my gosh, they really are impactful.
Right. I don't know if I'm more intrigued by that or that you ride your bike 10 miles. At this point, I'm like, okay, I can't say anything else. I'm done. But no, I love the intergenerational side of it. To mix our elderly and our youth like that in that young school setting, and they're getting to see her, and that just, they're starting their day, and they have to start it with a smile or they can't cross the street. I love that.
I like the fact of her just being so into and enjoying what she does.
Yeah.
And people need to take more pride in what they do.
Yeah, because she's impactful. She's as impactful as any part of that kid's day.
Absolutely. And what a joy to be able to look back on those memories and really for her to have so much love surrounding her. She's created that for herself.
She's created that.
Absolutely.
That's right.
Yeah. And so I think a smile a day rule, I think that's a good rule to have. You know, we're all getting older, and it's about time we talked about it. Until next time on Aging Untold.
On the next Aging Untold, planning a trip with an older adult?
You can travel with an older adult, but you can't travel like you're 30.
We'll show you how to travel safely and with ease.